Another possible roadblock to getting the COVID-19 vaccine. If you have already had the virus, you may not be eligible, at least not right now.
WPTV News Channel 5's Michelle Casada explains how long before a previously COVID-infected patient can get the vaccine at Publix.
Trying to save people time and frustration, Marika Appel of Palm City contacted WPTV.
I don't see it on TV. I don't see it in the news. I don't see it in the newspaper. I don't see it on the consent forms.
The 76-year-old had COVID in early January. Her husband, who's 78, had it in December. Living with an immune deficiency, Marika did not handle the virus well.
I got up. I wasn't feeling that well. I was in the process of taking my temperature and I passed out.
She spent 4 days in the hospital, but says she did not receive any antibody therapy. So based on the consent forms for the Pfizer and Moderna vaccines, she figured she was fine to get the vaccine. The couple started logging on to the Publix website every morning, like everyone else, to secure an appointment when a friend told them to speak to a pharmacist first.
You could only get it 90 days after your first symptoms. So I said, well, my husband, I said, don't bother getting up early in the morning. You know, there's no need.
So I called the local Publix pharmacy.
Thank you for calling your Publix pharmacy.
The response was the same Marika got.
They're not eligible.
The 90-day rule is just because they want to save the vaccines for somebody who's never had it.
Infectious disease doctor Leslie Diaz says she understands the need to vaccinate those who have no immunity first, but says it's not clear how much immunity one has after contracting COVID either.
Right now, there is nothing set in stone or any grading system that is commercially available to tell us how good it is. From a scale to 1 to 10, 10 being the most powerful antibody to combat any exposure.
Under the Know Before You Go section of Publix's COVID-19 vaccine site, it lists the CDC guideline that says it's okay to defer vaccine for someone who is within the 90-day from infection window because there is a low risk of reinfection during that time. Dr. Diaz agrees with that, but in Marika's case, she doesn't know how easy it will be to get the vaccine when she's eligible again.
Well, my immunologist said get it as soon as you can.
Michelle Casada, WPTV News Channel 5.